Okay, so thank you everybody for joining us. Welcome to our fifth and final presentation in the Coping with COVID series. As we've been discussing throughout the series, all humans are made up of 3 dimensions, so that's body, soul, and spirit. We just finished discussing coping with COVID mentally, emotionally, spiritually the past 4 weeks. And today we wanted to address the importance of staying physically healthy during quarantine and during this lockdown, since the body is the temple of the Holy Spirit. So for this evening, we're hoping that it's going to be 60 to 70-minute talk made up of small presentations by different healthcare providers that we have with us this evening. So we'll be covering nutrition, exercise, staying active, avoiding injury, eye health, medication, dental, oral health, general health, how to deal with cold and flu symptoms, and so many other topics. So this will then be followed by a 30-minute Q&A to the panel of speakers. So for the questions to the panel, please submit your questions using the Slido link. We're going to put that in the chat throughout the evening. And so state which presenter you're addressing your question to, and then we'll compile all the questions and they'll be answered by the presenters at the end of the presentations. So now I'm just going to do a brief disclaimer before we start. So the information provided in the presentation is general health information and is not a substitute for the recommendations given by your healthcare provider. We encourage you to consult with your healthcare provider for advice that is specific to you. The healthcare professionals in this panel all practice in the Greater Toronto Area. Information related to COVID safety and protocols reflect the recommendations and guidelines in the Greater Toronto Area and may be different in other regions. This presentation will not include information about the COVID vaccine, so we ask that questions about the vaccine be addressed to your healthcare provider. Okay, so we are excited to hear the presentation from our wonderful speakers. And our first speaker is Christine Francis. So I'll just give a brief description, or bio, sorry. She's a registered dietitian and nutrition expert currently working in a clinical capacity while managing her own private practice. She empowers individuals to nourish with food they love while ditching the vicious dieting cycle. Thank you so much, Christine, for joining us.
Thank you for having me. Is that my go-ahead? Thank you. Okay, let me share my screen. Can you guys see that? Can you still see that? It says sharing paused. Let me try this again. Start it and then share it. Okay, let me try this again. Can you see it? Okay, great. Okay, so thank you for the introduction. We're gonna just talk about some basic nutrition concepts tonight. We're gonna zoom through it because we're on time constraints, so hopefully it's not too confusing. Okay, so I find that during quarantine, people get really occupied throughout the day. So my biggest thing is to try to maintain some sort of a consistent eating schedule by planning ahead, whether it be your meals, your snacks, but also, you know, just listening to your own hunger cues. So you eat when you're hungry, you stop eating when you're full. But again, if you're someone that just eats all day, then maybe we need to find something to occupy yourself with, because there comes in like the boredom sets in. So whether it be an activity, a workout, going for a walk outside, occupying yourself with a puppy, Those are kind of some things that would be beneficial in that aspect. But then you also have to consider, are you finding yourself really hungry at a specific time of the day? Are you getting hangry around a specific time of the day? This is where we want to kind of try to avoid that by planning ahead with some sort of a nutritious snack for that particular time frame. If you're finding that you're always just really hungry around dinner time or in the evening time, this usually indicates that you didn't really have a balanced meal, which is why you're finding yourself hungry around those specific times. So the photo you see here to the right, this is usually what we kind of like to go by. So we always like to try and aim for half of our plate to be fruits and vegetables. Breakfast time, usually that's more so fruit than it is vegetables. But then we also like to see a quarter of the plate be protein. So whether that is lentils, eggs, chicken, tofu, whatever the case is. And then we also like to see a quarter of the plate being those whole grains. So couscous, quinoa, brown rice, brown bread, whatever it is that you prefer. But we also like to include some healthy fats at each meal to keep us full. So things such as avocados, yogurt, nuts, seeds. Those are all things that would contribute to the healthy fats in that aspect. But then we also want to ask ourselves, is this physical hunger? Is this emotional hunger? Or is it sensory hunger? So those three components in and of itself, we find under a framework called mindful eating. And that can be a whole presentation on its own. So I'm just going to try and summarize it as quick as I can. So physical eating, we find that it usually gradually builds up and you actually feel it below the neck. So you feel those hunger pains. You feel it kind of like several hours after you've already eaten. And it goes away after you've had something to eat. With the emotional hunger, kind of develops suddenly, and we find it more so above the neck. So, you're craving something, it just happens all of a sudden, and it's usually unrelated to time or the last meal that you had. In terms of sensory hunger, we usually find this when you see food, when you smell food. Kind of the things that stimulate your appetite. So those are the three kind of different hungers that we want to try and be mindful of whenever you're feeling hungry. When you are eating, trying to avoid additional distractions. So putting away the TV, turning off the TV, putting the phone down, putting like a book away. Those are all things that cause us to become a little bit out of tune with our hunger cues, and it distracts you from eating mindfully and actually savoring the foods that you're having and just being recognizing what it is that you're putting into your body. And then a question that I get often asked is, how can we maintain balance during COVID? It's okay if not every meal and snack looks like this photo. There are going to be times where your meals are more predominantly carbohydrate based, so whether it's a pasta dish. If you want to dedicate Friday evening to having some sort of a takeout meal, that's also okay. Like, this helps us maintain some of that normalcy that we had prior to COVID. Some things that you can try and implement while you're ordering takeout foods would be to ensure that, there's always some sort of a vegetable in that meal. If you want to try and ask for, the dressing on the side, look for things that are more so baked rather than the deep fried and the fried foods, skip the pop. But again, end of the day, if you're only doing this one time a week, I really suggest that you satisfy those cravings, because if you are restricting yourself, you're just going to find yourself in a vicious cycle. You're going to crave those specific things, and it's just going to be ongoing. So I always say to satisfy those cravings, and you're going to be more at peace with yourself overall. So this is my personal favorite that I always recommend, and they're called sheet pan meals, and you can kind of see the photo in the bottom right corner. So there's usually three components that we like to include when making something like this. So some sort of a carbohydrate, whether it be sweet potatoes, white potatoes, squash, corn, brown rice, quinoa. You can't really make in a sheet pan, but you can always make it on a pot on the side and include it. Always want to include some sort of a protein, so whether it be shrimp, salmon, chicken, they're all listed out there. And then the third component of that is vegetables. So those are where we get all of those nutritious fiber, the vitamins, the minerals. There's so many vegetables that you can include in sheet pan meals. So really, this is my favorite way. You can just put everything in all at once. It cooks all together. You just kind of put your dressings, your condiments, whatever it is that you want on it, and it's done within 20-30 minutes and dinner's ready. So if you're like me, and I currently don't work from home, but I do go into the office every single day, and around 2, 3, 4 o'clock even, you find yourself running into that mid-afternoon slump. And usually you want to reach for something to eat at that time, and you usually want something that's really fast to digest, something that is going to satisfy your hunger and your cravings. But we always want to build a balanced snack. So we always try to combine a carbohydrate with a protein or a fat. This makes it a balanced snack, and it prevents the blood sugars from going up really high and then crashing down really quickly. So that helps us, maintain the energy levels, preventing the midday slump and the crashes. And it actually slows down the digestion until your next meal. So here are some of my recommendations. They're on the screen for you to look through, but all of them, as you can see here, or most of them, I should say, most of them are combined with a protein or a fat. So for example, we have apple slices, that's a carbohydrate. And then we combine it with the nut butter, which there's definitely protein in there. It's definitely high in fat. And then I add some seeds on top, whether it be chia seeds, hemp seeds, flax seeds. Those are all composed of really great omega-3s and fats as well. So there's a whole list there. I hope you were able to take a look. Just move it over to the next slide. So this is something that I really want to touch upon, because I find it happens all the time in my practice. And if you know me and my philosophy, it's always that there's no such thing as foods that are healthy and unhealthy. I never classify things that are, I just never classify foods. So there's no such thing as healthy and unhealthy foods. There's different nutrition compositions and components for sure. Some foods may be more nutrient dense, whereas other foods may not be as nutritious. But they all offer some sort of nutrition. So whether it be, like, let's take potatoes, for example. Potatoes, everyone thinks they're like the root of all evil. But I don't know why, because they're composed of fiber. There's B vitamins there. There's energy, there's calories in those, so how are you going to tell me that something like a potato is unhealthy, right? So I want to bring your attention to the definition of health by the World Health Organization that actually says, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So that goes hand in hand with the way that we speak about food. So, the more we restrict ourselves and the more we tell ourselves that a particular food is unhealthy, the more we're going to create those negative connotations around those specific foods. And we find ourselves feeling guilty or ashamed when we eat those. So that takes the physical aspect, and it turns into it goes into the mental aspect at that point. So that causes us, it affects our mental well-being, and then it subsequently it affects our social well-being as well. So think about it post-COVID when we're all at a restaurant, and if you're thinking this certain way, then you're going to feel like when you're out with friends, you're not going to be able to eat those certain foods because, oh no, diet culture told me that I'm not supposed to eat those things, right? So it's a snowball effect. So that's why I always stress that, there's no such thing as a healthy and an unhealthy food. All the foods can fit into your diet. It's just about maintaining that balance. And I always say this, one day of healthy eating, whatever that means to you, doesn't make you all of a sudden healthy. And one day of unhealthy eating is not all of a sudden going to make you unhealthy. So it's about your long-term habits. And I also like to show this photo because, the one on the left where it says that's supposed to cause you weight gain because there's nut butters, there's chocolate chips, you're just going to think that, oh, there's too many calories there, of course I'm going to gain weight. The one in the middle being, oh, okay, there's only a little bit of nut butter, no chocolate chips, I'll just maintain my weight. And the one on the right, it's just an apple, you're going to lose weight. No, absolutely not. And that's so true. It is how food fear starts. So looking at images like this, where it says, yeah, this is weight gain, this is maintenance, this is loss, of course, you start to associate certain foods with, certain, whether it's weight gain or weight loss, you start to associate that, and you start to fear, oh no, I can't have nut butter, I can't have peanut butter, I can't have whatever kind of nut butter you like, because it's going to make me gain weight, right? So this is, it's a prime example of how individualized nutrition is. So the more we restrict, the more we're going to fear those certain foods, and it's a cycle, and it's never going to end. So it's very individualized. So, that's why when people ask me, what is the best diet, or make me a meal plan, or what can I eat? I always say it's more complicated than that. There's no one size fits all. And then just to end, remember, this too will pass. We're not going to be in quarantine forever. Focus on those long-term sustainable habits. Nutrition is way more than your habits in the now and this current time. We want to build things that are sustainable to bring us into the future, and to be able to carry those out, post-COVID, pre-COVID, whenever this thing ends. So there is my contact information. If you need me, I do provide one-on-one nutritional counseling as well. I also am very active on my social media, so that's where you can find me, and I do post more nutrition tips and recipes on there as well. So thank you.
Thank you so much, Christine. So our next presenter is Dr. Daniel Dimitri. He is a chiropractor devoted to providing evidence-based care to patients experiencing musculoskeletal pain. With a strong personal interest in medical research, he uses knowledge gained from recent studies and clinical experience to provide the highest standard of care to his patients. Treatments include a mixture of joint manipulations, rehabilitative care, rehabilitative exercise, and soft tissue therapy. So thank you so much, Dr. Daniel, for being with us.
Thank you for having me. How is everybody? Good, I hope. Yeah, so this is an interesting topic, talking about current state of the world, the pandemic, especially just even looking at this meeting right now. We're still on our desks. If some people are working from home, a lot of people are working from home, or they're not working, or they're working a lot more than they used to, which is happening to a lot of people as well. I just want to start with a little story. I just had a patient this morning. We had a massage therapist in our clinic. I just work in Waterloo there. And he sent me a patient saying, just be careful, he has kinesiophobia. So I was like, what's kinesiophobia? So kinesio means to move, and phobia is a fear. So he's afraid of moving. Just about 6 years ago, he herniated a disc, and he still thinks that his disc is still slipped, and what a disc is pretty much in the spine. We have bone, cartilage, bone, cartilage, bone, cartilage, and there's a little hole all the way through the spine pretty much, where our spinal cord passes and all the nerves pass throughout our body, and that's how we move. So anyway, when I saw him, he told me, he has a slipped disc, and I'm like it's still slipped? And he was like, I don't know. I was told 6 years ago I have a slipped disc. So that started an interesting conversation. And throughout the history, I asked him, how much activity do you do? And he just straight up said none. He is a project manager, senior business analyst, and he lost his job just about 6 months ago, near the first lockdown that happened there. So he's been kind of at a low point, generally speaking. He's waiting right now. He's studying extra courses to get a little bit more apt in the IT world, and he's spending a lot of time on his computer. Point is, when I asked him how much activity he does, he's like, none. I don't do any. I have a treadmill downstairs in my basement. And this is the part I want to get to, is he mentioned he had a treadmill downstairs, and I didn't really poke to ask, are you like exercising on your treadmill? I just said, but do you walk? And he's like, oh yeah, walk. I walk with my wife every day. So that's a really important point there. It's not just a matter of whether or not we're hitting the gym, or because gyms are closed right now that we can't exercise. Movement in general is incredible. It's great for us. And when it comes to injuries as a barrier to movement, in this case, somebody with kinesiophobia. They're afraid of doing things. And when I dug a little deeper, it turned out he's afraid of bending down, picking things up. He was trying to fix a playpen for his daughter 6 years ago. He heard a pop or felt something pop, and then he herniated a disc. He got leg pain and all the works. He's pretty much better now, but he's kind of in a flexed position, kind of leaning forward when he stands, unless I tell him to sit upright, and he still feels fine when he does it. Movement in general does not necessarily have to be an event or an exercise. It can just be that it's movement. And that's something that I really think is important for us throughout the pandemic, for everybody, especially working from home. Pain or no pain, injury or no injury, I could talk for hours, and I'm sure many of you can, about condition-specific conversations here. But in general, injuries and pain are biopsychosocial in nature. So that means that it's not just a mechanical thing. Pain, or let's just use low back pain as an example, or neck pain working from home in our offices. It's not just a mechanical thing. Oh, my desk is too high, or I'm spending too many hours staring at my computer that's giving me neck pain. No, it's the lack of mobility that has a pretty big contribution to that as well. And even then, the narrative that is important to have with yourself, or even if you're a clinician and you're talking to somebody else and they're trying to make it through the pandemic, working from home or just staying home or working extra hours, the narrative should be around things that are positive, not if you don't move, you're going to be hurt. And that's something that I hope that everybody here can grasp, is movement in general is a positive thing, and anything we can do to stay as active as possible, even when we have to have a sedentary job at the time being, is important. So some suggestions for that, every half an hour, I'd say just take 2 minutes just to move. And when I say move, you could just put your hands on your desk, get off of your chair, and just try to squat a little bit, and just try to type like that for a second, and still just stay in the meeting. No one knows. You could do it in your underwear if you want. No one knows. Or maybe they will, I don't know, but that's fine. At least your back won't hurt. The same goes for overwork. So somebody tells me, I'm working a construction job, half of our team's gone, and I'm doubling or tripling my hours. I'm very active, but my back hurts. How much leisurely time are you spending just trying to move? Because if you go from crazy activity to, like at work, labor, and then you go home and you're not doing anything, then you wake up and you wait for the hot shower to feel a little bit loosened up, and you go back to work, that as well, like if we rewind a bit, biopsychosocial, taking a second to intentionally move just for the sake of feeling good, it compounds. So something that I think could help kind of visualize that is, if you take a piece of paper every day and you put it on the table, and then the next day you put another paper on the table, and the next day you do that. You do that for a week, you just see like a paper, pretty much 7 papers, but it still looks like a paper. You do that for a year, you get a stack. You do that for 2 years, your stack doubles, and you keep going. And that's the compound effect in things such as movement and mobility. So some really cool tips with what to do. Like, I don't know how many people here are working just at home, or just their mobility and movement has went from here to here, especially if you have a routine at the gym or work or something, gets you moving. Some cool things to do is just take a second and go out of your way and intentionally try to get mobile. Work within parameters, and if you're concerned about a condition or specific injury that you do have, feel free to ask if it's okay. 9.9 times out of 10, it's okay. And if we can get past that fear, or that fear of the unknown, is it okay if I do this, or I have a slipped disc? Well, discs reabsorb into the spine pretty much within 3 to 6 months. They're not really slipped permanently. But just try to challenge yourself to move. I just saw Christina there do a little stretch. That's great. That kind of thing is really good. Just trying to take a second, but I would say don't do it while multitasking yet. Just try to spend, for every 30 minutes, 2 minutes, just do a little simple mobility routine. Maybe if you guys want, I could do one for you, or we could do it together. But even just putting your hands right behind your neck there, just as a light tent. If you guys want to join me, I'm going to do it. I'm going to look pretty silly doing it, but just shift on the top of your seat there, keep your feet flat. And just as you breathe out, just lean back, point your elbows up to the sky, and then just bring your elbows back down. And just try to curve your belly into a ball, come back, and just try to be a little windmill or propeller. Just like that. And then you could even take your hands back and do the same and just bring your chin down and up all the way. Even just doing something like that took 15 seconds, and it makes you feel just a little bit more alert and more aware. And believe it or not, productivity does go up when you're staying active, and you just make your heart pump a little bit more. Your focus and your mood can go up. Just some really important things is, again, injuries and pain, especially things from being at home. It's hard to just generally speak for pandemic because yes, our lifestyles have changed, but it's biopsychosocial. It means our bodies are involved with how we feel, where our like emotional state is, our spiritual state is, our relationships, where they're at. I know during the pandemic, relationships tend to become a little bit more volatile with differing and polarizing opinions, and people you are really close with, you just try to avoid certain conversations with right now. I don't know if anyone's experienced that. The nature of your lifestyle, your diet, just someone might have said something to you yesterday and suddenly your left hip hurts more than it ever did. And it's not as simple as I need to go buy a new desk or I need to get on my treadmill, but I don't want to get on my treadmill because I'm not ready to exercise because I just lost my job and I'm not in the mood. It's as simple as, instead of, I don't know, filing my papers here, I'm just going to move my stack of papers over there and file it there and just get up and do it. Or just drink a whole lot of water so that every 20 minutes I need to get up and pee. And my kidney's going to thank me, and so will my back, and my back, like everything's going to work. It's going to feel better. And that's another way to do it. I hope that helps. I don't know if I'm at time. It's 8:45, but that's what I got.
Thank you so much, Daniel. Okay, so our next speaker is Dr. Steve Skander. He is an optometrist who works at 3 clinics around the Greater Toronto area, and he does general optometry. He has a special interest in binocular vision. So thank you so much, Steve, for joining us.
Can you hear me?
Yeah.
Can you hear me? Awesome. Hi, everyone. I guess I'll take the eyes. I just want to, I'm trying to share my screen. Can you guys see that?
Yes.
Yep.
Yeah? Awesome. Okay. So I'll take the eyes, right? So how has the pandemic affected eye care, or at least our delivery of eye care services? So a lot of people visit the optometrist, but they're not really sure if it's safe. Well, I'm going to delve into that and also talk about what has really increased since the pandemic began. So it is high risk for me because of these reasons. So I spend a lot of time in close contact with several patients throughout the day in a small cramped room, basically exactly what you shouldn't be doing at other people's houses. And how are we basically allowed to do that? Well, if you look at the picture on the right, that's me from in Bolivia about 2 years ago on a mission trip with CMANA. Look how close I am. I'm so close to that patient, and there's no PPE anywhere other than my scrubs, right? So this would not be allowed these days. So how do we function? We need PPE. So it's vital, and it's required by everyone involved, right? So this is what I'm talking about. Masks, gloves. I wear eye protection because you can get COVID in your eyes. So basically, I cover my eyes all the time, but the patients are expected to wear masks at the minimum. Like that's like a minimum requirement. There's hand sanitizers everywhere. We do a screening. Basically, you know, all the usual stuff. One of my places has an air filter. I'm not sure if it does anything, but you know, it's there. So these are what allow us to remain operational, right? So without this, we couldn't deliver any eye care services or really any, you know, required healthcare services. And our eyes still have problems because of the pandemic, right? So just because there's a pandemic, it doesn't mean that eye problems have stopped. So we still need to deliver those eye care services. If you go on my Instagram, I just posted in my story like what it looks like at one of my clinics. So what it would be like to visit it. Basically, you come in and sanitize, fill this thing out. So if you want to check that out, you can. And follow me on Insta. And then bottom line, low risk for any one patient at any one time, because we make it that way. So we make it that way because of the PPE and other precautions that we take. In addition, eye problems don't stop because there's a pandemic. So people still need to come in to get their eyes checked, but I've noticed an increase in certain eye conditions related to COVID. What eye conditions am I talking about? So because of the macro trend changes, a lot of people are working from home and we're using screens a lot more, right? So because of that, that has an impact on our eyes. If you're nearsighted, so that means that if you can only see up close without glasses, but you can't see far away without glasses, that's called nearsightedness or myopia. We tend to notice an increase in myopia with the use of screens and other near work tasks. That includes reading a book, that includes like long-term on your phone or writing, anything like that. We know that especially in school age children, it does increase their prescription. The other thing is we get what we call Astanophia. So basically it's a cluster of symptoms like these here, headaches around the brows, forehead, and temples. So what these people are kind of showing us is symptoms of Astanophia. You may think they're being a little bit dramatic, but this is actually how people feel after a long day on the computer, day in, day out. So blurry vision, double vision is a big deal. It's something we do have to deal with more. It's more rare, but it's more serious. The other thing that COVID-19 and screens have an impact on is our dry eyes. So our eyes become more dry, I should say. I'll get into this a little bit more, but this is precisely why. So when it occurs with screens, we call it computer vision syndrome. So I guess I should talk about this first. So near work and Astanophia, they are linked, right? So Astanophia is those symptoms that we talked about before. And basically they are very related. So if you look at an eye here, this is looking far away. There's a little muscle here. It's called the ciliary muscle. It's in a relaxed configuration so that we can see far away. If you look over here, this eye is looking at something up close. So imagine it's looking at a computer. This ciliary muscle is contracted. So if it stays contracted all day, all night, or day in, day out, basically we have prolonged periods of near work because of the pandemic. This muscle stays contracted for longer periods of time. You get something called referred pain. So referred pain around the brows and temples and forehead. And that's where you get the symptoms of Astanophia. And the other thing is screens with dry eye disease are inherently related and linked. So this is one of, it's a big inducing factor for dry eye disease, as well as I've noted an increase in this because of the screen time. And so we get an increased amount of screen time. Our increased amount of attention on what's on the screen leads us to blink less and blink less forcefully. So those are two important things. So we get an attenuated blink reflex leading to dry eyes. So what's the big deal about that? There's something called this tear film, and it's a layer of tears, very thin. It's like 50 nanometers or something. I see it on the biomicroscope in front of a patient all the time. It's supposed to be optically clear and smooth. And so that's what blinking actually does. So when it's attenuated, it affects our ability to see clearly. Okay, so what do I do, Steve? This is what to do. Basically, artificial tears are a good way to go, except when you go to a pharmacy, this is what you're greeted with. I can tell, like if I see you as a patient, I can tell you which one is specifically right for you because they're not all created equal. They are basically like some have different kinds of preservatives, some have different kinds of ingredients to treat the dry eyes, but they're not all as beneficial as each other. A lot of patients come in using Visine and Clear Eyes. No, stay away from those. Specifically the red relieving drops. They don't work as well as you think they do. They honestly, I would never recommend them. Stop using them because they basically, So they basically provide no value. So they work because of a little molecule that constructs the blood vessels and makes our eyes look more white. Honestly, it's not as beneficial as we think because it does constrict the blood vessels, but over time it causes your eyes to become more red. So don't use these, stay away from these. No one ever recommends these. I would also recommend that you try purposeful blinking. So basically, if because of our blinking reflex is attenuated, there's a fly, sorry. Basically, you have to force yourself, you have to think about it to blink. Blink every 5 seconds and blink hard. So if your eyes get a little bit blurry, blink forcefully, like blink forcefully every 5 seconds for a little period of time. It should clear itself out a little bit. Pair it with the artificial tears while you're on the computer, okay? So all of those things will help stabilize that tear film that we need to see clearly, okay? So in terms of a screen, we focus on, or we kind of dish out a rule called the 20-20-20 rule. And basically you kind of look at something 20 feet away for 20 seconds every 20 minutes. Okay, so it makes it easy to remember when we say the 20-20-20 rule. Good idea is to actually look outside. So look through a window. If this dog can do it, you can too. I have a window next to me and it just leads to a brick wall, so that's no good. But go look outside. At a window, it's better for your mental health, but also it's better for your eyes. So if you can focus on like the leaves or a car or something like that, it's good for your eyes because you are relaxing that muscle that stays contracted throughout the whole time that you're looking at a computer. The other thing is we have computer glasses. So if you visit an optometrist, you need a prescription for this. Basically, you kind of get fitted for these glasses. They're not like anything too special, but they just focus on that distance, what we call an intermediate distance, where your eyes are from a computer screen. And so if you look at this graphic, there's a computer screen here. You're supposed to look at it through the glasses, and then at the bottom part is like a little bit more focused area for like reading stuff. So if you think about what it does, basically it focuses for you, for your eyes. So if your eyes aren't doing the focusing, they can relax, and that's better for the symptoms of Astanophia. I get this question a lot. What about blue blocking lenses? I got this question from the first patient today. So patients generally know about this. It's a well-known thing that blue light blocking lenses is related to computer use. It comes from the fact that the blue light receptors in our eyes, they lead to the part of the brain that controls our sleep-wake cycle, right? So where the hormone melatonin is released. So there's some evidence to support that blocking that blue light that's emitted from screens can help us with if we suffer from poor sleep quality. Now, it's not really that conclusive. So there's some evidence for it. It's not 100% though. So what I usually say is it's good if your lack of sleep or your poor sleep quality is related to you using screens a lot, especially for your job all day, all night. It's worth it for you and your eyes to get that coating. Honestly, any other symptoms, there's all these claims out there. There's no evidence to support that it helps with anything else. So if you want to use it for those purposes, just understand that it is a placebo. Some people say it works, great, use it, go ahead. But there's no evidence to support that it works for that. So if you don't remember anything else, basically get your eyes checked at least every 2 years. So no longer than that, please, because there's a lot of issues that can happen with the eyes that we just can't detect unless you come in, because a lot of stuff doesn't have symptoms. Lots of things do have symptoms. Lots of things don't have symptoms. And so some of the things that can be blinding, you may not know are happening unless we tell you. So basically it's a good idea to get checked every 2 years minimum if you're healthy, irrespective of glasses. Has nothing to do with glasses or no glasses. And I want you to just remember that you can feel safe at our offices because of all the protective protocols that we've inputted. So, it's not like old times, but it should sort of feel like that, okay? If you have any questions, you can email me. You can DM me on Insta. That's all I have to say, but check out the story again if you want to see what it looks like. I guess if you have any questions, let me know. Otherwise, I'm all done. That's all I have to say.
Thank you so much, Steve.
No problem.
So next is Andrew Moros. He is a pharmacist who worked in community pharmacy for over 5 years and has recently made a move to hospital pharmacy. Currently, he works at the West Perry Sound Health Center, covering everything from ER visits to long-term chemotherapy and palliative care. He is also a clinical instructor at the Faculty of Pharmacy at U of T, and in his free time, he likes to do creative writing. So thank you so much, Andrew, for joining us.
Hey, can you guys hear me all right? I put on the headphones because they have a better mic than my computer. Hi, guys. My name is now officially Moros Masih. That's a long story. We'll get to that later. And yeah, I'm a pharmacist, probably like many of your cousins and uncles and parents and family members. So I'm going to keep this short and sweet, and I'll just try to focus on a couple of very specific things regarding life in quarantine and how it affects your health in regards to pharmacy. In the hospital, we have this thing called the BPMH. It's called the Best Possible Medication History. When a patient comes into the emergency room or to any place in the hospital, the first thing you have to do is get their medical history, figure out what they're taking at home. Now, here's the problem. Quite often, the list that their doctor gives them doesn't match the list that their pharmacist has, which doesn't match the list of what the meds that they take at home, and it doesn't match the list of what their family members think they take. that is 90% of my problem at work in a nutshell. And that is one of the big things that I just wanted to focus on just talking with. So a lot of times this might not necessarily even apply to you, but it might apply to someone in your family, parents, grandparents, older siblings, something like that, people who might be on a handful of medications, or even yourself if you're on a handful, or even one or two medications. Because a big thing that we found, and I'm sure you've all found during the quarantine period, and it was mentioned, actually, Daniel mentioned it a little bit, was that your routine changes. Your routine changes a lot. Things that you used to do regularly kind of fall to the side. So you want to be extra careful with that when it comes to taking care of your health and taking your medication. When I worked in community pharmacy, I still remember a patient walked in and his blood pressure was through the roof. And I'm like, sir, you were here like 2 months ago. We talked about your meds. Everything was going great. Your blood pressure was great. What happened? He's like, well, I went to Jamaica. I'm like, uh-huh. He's like, yes. So I took a vacation from my medication as well. I'm like, that's not how it works. So you got to be careful with some of these things, because a lot of these conditions, high blood pressure, cholesterol, you don't feel them. You might not feel their effects until years later, but you still have to take the meds for them anyways. Taking a vacation from your medication is not the same as taking a cheat day from your diet. But like, even if you take a cheat month from your diet, that'd be a problem too. So that's the main thing. So easy ways to combat this is making schedules, setting alarms on your phone. Most of you would know this, is that pharmacies quite often offer something called compliance packs or bubble packs or blister packs. It's where all the meds are put in for the days of the week, and it makes life easier for you. More often than not, pharmacy does that for you. You can do these on your own with little packages that they buy there as well. You could fill them up for what meds you need to take, what time of the week, but just to make a schedule and to make sure that everything is followed accordingly. And as a heads up, like, I'm not sure, once again, I'm sure half of you are related to pharmacists. So you'll know this. Most pharmacies offer delivery and free delivery these days. So you don't even have to show up. The medication will show up to your door. It's very easy stuff. It's just the important part is trying to stay on top of these things. That's the big one I wanted to cover. The rest of the stuff is going to be just your basic cough, cold, and virus. As most of you are well aware, if you have a virus like the flu or like COVID, antibiotics don't actually do anything. Most of the time, if you go to your physician, they will tell you go home, have warm fluids, rest, and have Tylenol. I'll let Dr. Gina Zachary speak about that later, but that's pretty much what they're going to tell you 90% of the time. So that's the main thing that I'm just going to give as a heads up. There are vitamins and supplements, and most recently they're talking about vitamin C and vitamin D and echinacea and ginseng and a bunch of other things. The evidence for them is not great. For some of these medications, like ginseng and echinacea, zinc lozenges, if you take these consistently, you may reduce your flu-like symptoms for about 2 days, by about 2 days, max. And even the evidence for that is flimsy at best. Okay. So the only thing I'm going to focus on, I'm not going to tell you which ones to take, which ones not to take. The main thing I'm going to focus on is just the safety issues. To make sure that whatever it is that you're taking, that you're following up with your prescriber or your pharmacist, asking them questions before you take it, because a lot of these things have interactions with other medications, and that you're following the directions on the bottle. So something as simple as, say, vitamin C. Vitamin C is pretty basic stuff. You get that stuff from oranges, lemons, tangerines, whatever. It's easy stuff. If you take too much of it and you have kidney problems, you can get kidney stones and you can get problems in that regard. Not great. Zinc. Zinc is a half decent one for cold and flu symptoms. If you're taking the lozenges, you're okay. If you're taking the nasal spray, you can get permanent loss of smell. There's a lot of other ones that have worse side effects over time. Even when it comes down to something as simple as cough and cold medication. When I was working in community, a patient would ask me, can I get something for a cough? I'd ask them about their entire history first, because some cough and cold medication won't work if you have blood pressure issues. It'll make the blood pressure issues worse. If you have kidney issues, it'll make those worse. If you have diabetes, it won't be helpful with the diabetes. Or if you're taking another medication, so certain blood thinners and sleep medications and antidepressants can interact with cough medication, and you'll actually have a problem there too. So my main concern is not to tell you which meds to take, but is to focus on the safety of these medications. Okay. Taking a bunch of extra vitamins and minerals sounds like fun, but just to be on the safe side with all of them. Yep. I want to make this as short and sweet as possible. There are natural products, like some people like to use honey for coughs, which is fine. Honey actually works pretty decently for younger people for coughs. Whether it's a placebo or not is irrelevant because it works. But you can't give it to anyone who's under 1 year old. Just to make sure that you're following the safety guides on all of these meds. The other thing that I just wanted to touch up on really quickly is your home medicine cabinet. Everyone, go to your medicine cabinet and clean it up. I'm sure you have a lot of expired things in there. You should probably get rid of it and use some stuff that's not expired. What you should have in there is something like acetaminophen or just your Tylenol, something like ibuprofen, which is your Advil or some other NSAID. Those help with pain, those help with fever. So if you do have pain and a fever from influenza, cough, cold, whatever, you can take those according to the instructions on the bottle. And have something, I always recommend that people keep some form of anti-allergy medication like Benadryl or diphenhydramine, because if you take a new medication and you're allergic to it, it's good to have an anti-allergy medication with you on the side. Or if you have someone visit your house, inshallah, someone visit your house and they're allergic to some of the food in your house, it's good to have an allergy medication on the side. If you have seniors in your home, it's good to have aspirin 81. That's kept in emergencies just in case of a heart attack or stroke. Of course, first aid kits, some kind of antibiotic ointment like polysporin is great as well. But that's pretty much it. I don't want to, oh, one last thing. Your phone, it's fantastic. It has sections where you can put in your medical conditions and your emergency contacts. And any other issues just in case of an emergency. So feel free to set that up when you guys get time, and it would be a very useful tool for you should you need it. And that's it.
Thank you so much, Moros. So our next presenter is Dr. Rafiq Zeki. He is a dentist who founded Sunray Dental Center in Mississauga and practices general dentistry, implantology, oral surgery, crowns, root canals, and pediatrics. His hobbies include working out, playing guitar, water sports, and traveling. Thank you so much, Rafiq, for joining us.
Thank you, Mary. So I was asked to talk to you guys about oral health during COVID. So I have, one second. Can you guys see my screen or?
Not yet.
Not yet.
Should be able to share it.
So it's not letting me share the screen.
We have you as co-host. One second.
Hold on a second, I think. Can you guys see it now?
Yep.
Okay, awesome, thank you. Okay, so I was asked to talk to you guys about, how to take care of your oral health and keeping your teeth healthy during COVID. Now, during COVID, some people are still working, and essential workers that are still about on the side, and their day-to-day maybe hasn't changed much. And some people, their work, like they have the opportunity to work from home. So I think if you work from home, maybe your excuse of not brushing your teeth and keeping your teeth clean may have, a little bit less. But in either case, it's really important to keep your oral cavity clean and keeping your oral health in good condition. So just before I start, we'll just talk about health. People think being healthy means that there's the absence of disease. So people say, oh, doctor, I don't have pain, so why do I need to go visit the dentist? Now, the problem with that is sometimes there are problems going on, and those problems don't cause pain. So what happens is you go on with your life and you're enjoying your life, and all is good, and then all of a sudden something blows up on you, and then all of a sudden you go to the doctor for emergency, and then you find all sorts of huge problem. And a lot of these times, these problems don't just happen overnight. It's not like you just sleep and you wake up and then all of a sudden, this massive infection comes. It's usually something that builds up over time, and then it really comes from neglect, to be very honest. So that's why absence of pain isn't really, or absence of, disease isn't really a good indication of staying healthy. So, the WHO says the physical, social, and psychological well-being. So it's actually the well-being of the person, not just the absence of disease. And, God, the flesh that we have is a gift from God. So we should take care of it as stewards of this body, right? So a lot of people also think that oral health is just strictly the mouth. But the truth is, oral health actually it's part of your body, and it affects every other aspects of your body. It's not just if you have a tooth problem that it's only a tooth problem. It can only be a tooth problem, but that tooth problem can also cause other types of problems. So, there's studies that show correlation between, periodontal disease or gum disease and diabetes, and gum disease and cardiovascular disease. So keeping your oral cavity healthy also affects your overall health, and your overall health also affects, your oral cavity. So if someone, for example, is diabetic and diabetes is uncontrolled, it's also going to affect your gums and your oral health. So it's all connected. It's not just segregation. Now, I know we're talking about it as segregate, but it's really all connected. Now, so during COVID, what can I do to keep my oral health clean, or keep my teeth clean? So brush at least twice a day, floss daily. Now, I know this may be an annoying one, but I had no choice but to toss it on there. Use mouth rinses. If you have an appliance, so if you have aligners or night guards or dentures or whatever it is, we'll talk about that in a second. Keep them clean, and I'll tell you guys how to maintain them. And go visit your dentist, and no smoking, right? So, how to brush your teeth? Well, it doesn't really change whether there's COVID, whether there's a pandemic or not a pandemic. It doesn't really affect, the way you brush your teeth. It's something that should be done before, and it should be continued after. And so the way that you do it properly is that you want to take the brush and you want to put it at 45-degree angle from the gum line. And what you essentially want to do is put toothpaste along the entire length of the toothbrush. Put the toothbrush 45 degrees to the gum line, but don't push it very hard, because then you can start wearing your gums away. So gently, but with enough pressure at the same time. And you want to go in circular motion, okay? So you want to go, a couple of circles, and then you want to go all the way along the outside. I'm going to show you guys in a second. I have a little type of note. I'll just show you the slide first. And then after you go on the outside, you want to brush the top surface. And then after you've brushed the top surface, you want to brush the inside. So if you look in the diagram on the left, you want to brush all surfaces, not just, people usually grab the toothbrush and they kind of just stroke, 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 and you know, just a little bit here and there, and then that's it. They rinse, and then that's it. They keep their quote unquote teeth clean. So you know, do it properly so you prevent further problems from happening, right? I'll show you guys in a sec. I'll just show the flossing one, and then I'll do a little demo for you guys. Yeah, so you want to brush the inside, the top, the front, the back, not just the top surface, right? Because so the thing is about teeth is that teeth are non-shedding surface, right? So your skin sheds, the inside of your mouth lining sheds, but teeth is non-shedding. So it's a good place for bacteria to accumulate and hang on because it doesn't shed. So that's why it's important to keep it clean, you know? And the thing is, if you lose a little bit of tooth, it doesn't grow back. It's not like skin. So that's why it's important to also, you know, keep it clean. And it's the fact that it's non-shedding is what makes it a good place for bacteria and calculus and plaque to hang out and quote unquote party, you know? So flossing, also do a little bit demo on that one. So the way that you floss properly, now people, you know, have come to me and said, oh, but I found this study that flossing doesn't really do anything. And, you know, the truth is, yes, it does, and it's important, right? So without floss, how are you ever going to clean between your teeth? Because your brush can't get there. So you need something else that will, right? So the way that you do it is you're supposed to put the floss inside, and you want to make a C. Like if you look at that diagram there on the right side, and then what that'll do is that'll take the floss and wrap it around the tooth, and then you pull up, so that if there's any plaque in that area or any food or any, you know, whatever it is that's there, it'd be flicked off, and this way you keep it clean. Now I know, and then you're supposed to put it back inside and make it see the other way, and then you pluck it right out. And I know this is a bit tedious, and you know, I'm not gonna lie, it is maybe a bit tedious, but with habit, it becomes second nature. And it's not, it maybe in the beginning it's a bit tedious, but then after a while it just becomes natural, and then it becomes, then you won't be able to go to sleep unless you floss your teeth. It's kind of like, you know, working out. Maybe in the beginning, working out is kind of a drag, and you know, it's kind of annoying, and you know, your muscles are all sore. But then comes a point when you probably can't go on a day without working out, or you can't just go on a week without working out. So it's just building habits, right? Now, I don't know how I'm gonna do this, but just give me a second, guys. Can you guys see me?
Like,
I
we
can
still
see
see
you.
your share screen, but we see you too.
No, I want to just remove the share screen, and oh, there we go. Gotcha.
Yeah, there we go.
Okay. Okay, so this is a little mouth. Okay, so the way that you do it, you take the toothbrush, all right? You put toothpaste all along the length of the toothbrush, okay? And then, actually, I'm gonna just remove this. This is gonna be easier. Okay, so we're gonna assume this is your mouth, okay? So you wanna take the toothbrush, you wanna put it 45 degrees. This is actually very hard for me to do. I didn't expect this. Okay, so you're gonna go 45 degrees to the gum line. Can you guys see that? Hold on. We need to like, okay, so 45 degrees to the gum line, and you wanna go circular motion, right? So 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4. And you're gonna go all along the way on the outside and the upper arch. Then you're gonna do the top. Hold on. So the top, you're gonna go as follows, right? Just the top, like that. And then like you do on the outside, so remember 45 degree right at the gum line, circular motion. You wanna take 2 teeth per the length of the toothbrush, and you go, you know, so 1, 2, 3, 4, shift. 1, 2, 3, 4, you continue shifting. Do you get it? And like you do on the outside, you also do on the inside. I'm gonna show that one. It's gonna be a little bit tricky. Okay. So like you do on the outside, you also do on the inside. And you wanna go, you know, 1, 2, 3, 4, and then you shift over 1, 2, 3, 4. And then when you come to the top, you wanna just go like this, okay? And then when you go to this side, you also put it 45 degrees to the gum line. Can't really show it, but you know, there we go. This is perfect. So 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4. And don't forget to flick off the ends of your last teeth, because it's a good area for plaque and stuff to accumulate. And like you do in the upper arch, you also do in the lower arch, right? And this should take about 3 minutes. It doesn't really take that long. It's not like a long, tedious, like, you know, and I got water all over my computer. That's fantastic. Okay. Now flossing. Okay. So for flossing, you want to wrap the floss around your middle finger, okay? And when you want to floss down, you push down with your index, okay? And when you want to floss up, you push up with your thumb. And then when you go, now, I don't know how in the world, okay. So you want to go in a contact, you want to make a C and then pull up. And then you want to go in the exact same contact, make a C the other way, and then pull up, okay? And then you're supposed to do that all the way around so that this way you clean the plaque and stuff between your teeth, right? So this should be done regardless of COVID. This is just keeping your oral health clean. The advantage of mouth rinses is that you also want to clean, you know, the back of your throat. There's bacteria in there. There's bacteria on your cheeks, on your tongue. Sometimes brushing your tongue can help. Okay, and I'm going to go back to share screening. Mary, how much time do I have left, by the way? I think I only have, is it 5 minutes or?
Yeah, a few minutes.
Okay, okay. Right, so with regards to mouth rinsing, it's important to also, you know, gargle so you can get the bacteria from the back of the throat and your cheeks, and just rinse off for 1 minute and then spit. So one of the problems during COVID that we find as dentists is that people, you know, they're scared to go to the dentist, and because they're scared, they don't get their teeth checked and they have problems that they don't get addressed, and eventually they end up coming as emergencies, right? So that's not a good way to think. Now, some of you may be wondering, oh, but we're scared of getting COVID because you're going to the dental office and there's a risk of getting COVID. Now, so the risk of getting COVID, really, if you go to Walmart, there's a risk of getting COVID, to be honest. As long as if you're interacting with someone, there's a risk. But as oral healthcare professionals, we take measures to try to protect ourselves and protect also patients from cross-infection control. So the way that what we do to protect others is that whenever someone, first of all, there's no walk-ins, it's only by appointment. And patients get screened over the phone, and they also get screened when they come into the office. And then when they come inside, you know, they're social distance, so we don't have people sitting beside each other. We try to keep, you know, only one person at a time so that the patient doesn't interact with other patients. So usually what we'll do is we'll keep people in their cars, and when the patient's done, the one person will go into the operatory room, and then the one will wait in the waiting room, and such and so on. And then in the waiting room, you know, we have plexiglass, and everyone has to have masks on. And one of the big concerns with dentistry is aerosol generating procedures. So COVID is really in, you know, the mouth is, if someone, God forbid, does have COVID, you know, the mouth is really where it'll be. So if someone does a procedure like drilling, it generates aerosols in the air. So how do we as dentists, we take care of that so that someone doesn't inhale the virus from someone else and have a cross-infection problem? So if you look on the left, we put like a seal from floor to ceiling to conceal the air in the room. And inside the rooms, we have something called HEPA filters. So these are filters that filter air at a certain rate. And the HEPA filters also filter small particles as small as viruses. So this way, that when the air gets filtered, it keeps the air clean. So then when the next person goes in, 99% of the air from the previous patient has already been filtered. And the way that it works is there's an HVAC engineer that measures this. You know, they look at the volume of the room, and the filter has an air change rate. And then from the air change rate, You can determine how long it takes for the air to be filtered, 99%. And also as dentists, you know, we have to protect ourselves and protect our staff. So we also wear full PPE. We have face shields, face masks. We have gloves, obviously, gowns that we put on between patients. So we take all these measures to protect people so that they're not, if they ever need to go for a dental appointment, that the risk of them getting COVID is very low. These are guidelines that are set by the Royal College, and all dentists across Ontario have to follow these guidelines. And to be honest, I think they're fairly they're solid. And you know, so we wear the full PPE. So don't be scared when you see us all suited up like that. We have to do it to protect ourselves and protect you as well. And last but not least, I just wanted to say that, you know, oral health is important, because you probably noticed the guy's missing his tooth before you notice that he's missing an eyebrow. So I'm not underlying any other, you know, health related problems, but don't let COVID-19 cause you fear to go seek oral health services if you need it. And if anyone has any questions, please let me know. And that's it. Thank you.
Thank you so much, Rafiq. And especially the props gave us a good visual.
Oh, yeah, that was tough, but thank you, Mary.
So our next presenter is Dr. Gina Zachary. She is a family doctor who practices general family practice in an outpatient clinic in Scarborough. She likes to spend time with family and her kids, which is a hobby that flourished during COVID. Thank you so much, Gina, for joining us.
Thank you. Can you hear me okay?
Yep.
Okay. Okay, guys. So today I've been asked to cover a few things, so I'll do my best to keep it short and sweet. So most importantly, my talk is going to be about accessing healthcare, of course, why you might need to access, how you can access, that kind of thing. So some common reasons why, why you still need to access your family doctor. General checkups, regular tests, screening, if you need your regular medications, all of these services are still available and important to access. So early in the pandemic, a lot of the general checkups were put on hold. However, now we're back to offering the preventative care. This, of course, is dependent on your age, risk factors, family history. There's lots of things doctors are still doing. So if you are due for your regular blood work, screening for cholesterol, checking, so annual blood pressure measurements are so important. So these are things your doctor will talk to you about and how you can do them. For example, blood pressure, the doctor would counsel you to go to a pharmacy to measure, if you have a machine to check. Otherwise, you can come to the office for an appointment, but that's something important. Monitoring your weight. So if you have a scale at home, then it makes it easier. You don't have to physically be in the office, but again, reaching out to your doctor to talk about these tests and these things and what needs to be done. Yeah, and then a little bit about chronic medication. So if you do need refills, again, ask your doctor. If something acute comes up, any symptoms, your doctor is available and family doctors are available. This should all continue within the pandemic. So don't leave things on the back burner. Don't leave things to the last minute. Now, as far as when a test should be done, that's a discussion that once you access your family doctor, you can have with them. If it's something urgent or if there has been changes in your health, it's a risk-benefit assessment. Is it safe to go out right now and do this test? And if that's an important thing you need to do, again, your doctor will encourage you. Otherwise, the doctor might say, maybe in 2 months, do this specific test, and then they can email you the requisition or refer you to do that test at that point in time. So the main thing is don't delay your symptoms, speak to your doctor, and then they will decide when is an appropriate time to go ahead and do this test during the pandemic. Yeah, so I talked about a lot of people leave symptoms to when they get more serious, or sometimes they just don't know and the access is available and they defer seeking the help, especially even deferring going to the emergency room if there is an urgent symptom or something that needs to be dealt with. A lot of people are deferring or waiting a week until they can get in to speak to their family doctor. Okay. So how have things changed a little bit during the pandemic? So how are patients accessing care right now? So most of the family doctors and specialists are providing virtual care. So this is either done through a phone consultation or through some offices are set up to have video conferences, so they would actually see you. So if you have, they can do an exam via video conference or look at something via video conference. Also now email is widely used. So for example, things like emailing, again, requisitions to go do blood work, tests, or patients emailing in, like if they have a rash or something they want the doctor to look at. If it's in a non-sensitive or private area, then lots of offices are using email in that way. So there have been offices that, unfortunately had to close down during COVID, but most are still operating. And if your family doctor is one of those that had to shut down, look it up. There's going to be something available in your area. So main point, access care when you need it, and don't neglect your again, general checkup. And this is also based on your age, like I said, family history, but reach out to your doctor to have that discussion, what should be done now and what can wait as well. So the steps you should take. So if you decide, okay, now I'm going to reach out to my doctor to talk about this symptom or this thing I've been having or whatever concern you have, call the office. So you don't need to go in person. Many of them will explain the process of how to get an appointment over the phone. Many have updated their websites as well. So again, before they might have not now, so you can access that as well to get more information. Some have online booking as well, so reach out. Now there are, so now you made an appointment. What are some things the doctor can cover during a phone consultation? There are certain things a doctor can do. So the purpose of the visit, there's a few purposes of the visit. Number one, is this something that can be managed on the phone alone? So if you have a rash, you send a picture, the doctor sees it, diagnoses it, and treats it, discussing screening tests, discuss ordering tests and things like that, even referring to a specialist. So sometimes based on the history alone, the doctor will say, okay, I know, I do think you need to see a specialist, and then you can be referred and not have to wait for so long. And then, and you're not waiting for so long because I'm implying that you've accessed care early and not put this on the back burner for many months and then presented a little bit late. So yeah, and so a lot of specialists are also seeing patients over the phone, and then if really necessary, they will bring you in the office for an exam. So in-person visits are still happening. So that's number one. Can I manage it over the phone? Number two is this issue urgent or not? So if you present with a complaint, on the phone, I have to decide, or your doctor will decide, do they need to be in the hospital or not, in the emergency room or not? And sometimes that is the recommendation. Not everything can be seen over the phone. And if the story is concerning or red flags or anything, and your doctor says, I do think you should go to the emergency room, do not be afraid. Emergency rooms are safe and you can go, and we'll talk about that later in a little bit about certain precautions everybody's taking. And the last thing during the phone visit is, okay, this is not urgent, but this, I have a good story that I took from you over the phone, but I still need to see you in person. And this is where in-person visits are still offered and available after you've done the phone assessment to see, based on the discretion of the physician. So, and then you would be booked accordingly to be seen. Other reasons you might be seen in person. So offices are still open for immunizing young kids, or if you're due for any immunizations, your tetanus shot, your flu shot, if you didn't get it, you can still look and see who's still offering it or who still has it. So none of this is delayed during the pandemic. These things are still important and everybody should still access care for them, okay? Okay, so now I'm gonna talk a little bit about what to do if you have cold, allergy, or COVID symptoms. So as you probably know, COVID has many faces. So it can look like allergies, it can look like a cold, it can look or like a runny nose, a fever, a cough, diarrhea, vomiting. Some rashes can be COVID. So any change, any acute changes speak to your doctor first. So you call in. Now, when it comes to having a cold or allergies, it's very hard to differentiate what's what. If your doctor knows you well and has a clear history that, you know, every year in this season you get your allergy symptoms, and is comfortable to prescribe you like a nose spray and tell you to stay home, sure. Or maybe you have allergy symptoms, but your doctor is not clear or hasn't treated you for this in the past. In general, there is a low threshold to testing for COVID during the pandemic. So unfortunately, you know, if there is any cold symptoms, well, not unfortunately, this is, you know, and we'll talk about accessing the COVID assessment centers, but if there is not a clear cut, you know, story, I have runny nose, it's been a week, it's, you know, we should check for COVID, or I have a fever or a cough. And then if you are someone who has, you know, symptoms that are similar to COVID, like if you have allergies or asthma, and maybe you weren't taking your medications before, it's very important now during the pandemic that we maintain these chronic conditions and prevent their flares, so that if you flare up with your asthma and you get all of a sudden coughing and trouble breathing, we don't assume it's COVID or not COVID. So important to prevent a flare. So if there's a new change happening, then that would be alarmed for, okay, maybe let's do a COVID test. And again, if you've had no symptoms and all of a sudden you get sick, again, low threshold for testing for COVID. And this is to protect you, you know, our community, your family, coworkers, if you're still working outside of the home, and just others around you. So if you do have symptoms and want to be seen, most offices are not seeing actively symptomatic patients. So of course, this is to protect the other patients that they're bringing in. So they're like, you know, lots of the visits in person, as I mentioned before, are seeing infants and young children or healthy, non-symptomatic patients that are there for other reasons. So it's very difficult to bring in someone symptomatic. Also, this is to prevent the staff at the office from being sick. So if the staff is sick, if someone catches COVID, and then everybody has to be home, this will delay, you know, timely access of the other patients to the practice, to the services of the practice. The administrative duties of the staff is delayed, like referring, following up on results and things like that. So this is why family doctors' offices are not they're not seeing patients with active symptoms. Also, the rooms are small. It's very hard to have any protocols or to separate, you know, areas with symptomatic and not symptomatic patients. So if you do have symptoms, go get a COVID test. If not, you can talk to your doctor. Well, if you don't want to right away, you can also call your doctor on the phone and discuss again with them and what they recommend. And I'm going to repeat again, there is a low threshold for testing for COVID. If you're really feeling unwell though, you know, really bad sore throat or a really bad cough or trouble breathing, there are cold and flu clinics set up for this purpose. So some of the hospitals in the GTA, so I know Michael Garron Hospital has one. I'm not sure exactly which hospitals, but it's something you can Google. So they're all cold and flu clinics where you would go, they would do a swab, but they would also be able to examine you and do a full exam. If your symptoms are mild, so also what I've been hearing from the COVID assessment centers is that when you go in and for a COVID swab, they still take your vitals. So they check your blood pressure, your temperature, heart rate. The doctor, they're doing the nose swab. If you're really symptomatic, they can look at your throat, listen to your lungs. If they think you're quite sick and you need to be in the emergency room, they will tell you to go there. Otherwise, they can do a quick exam as well. So those are the options, mainly if you do get sick. Now, let's talk about COVID assessment centers. So if you have any symptoms, that's where you should be. They are located in all the hospitals in Ontario. It's very fast access, either same day or next day is what I've been told by many patients. Easy to book, you just log in online, or they have a phone number listed on their website, you call and you book for a COVID swab. They have a ton of precautions, just like the emergency rooms, family doctors' offices. You know, all the staff are in PPE, masks, gowns, gloves, face shield, wiping down high-touch surfaces, making sure that the places where patients are not overcrowded, leaving distance 6 meters between each patient. So this should not deter you from seeking any medical care, whether it's the emergency room or if you need a COVID swab, definitely go. Some other things that nope, I covered it all. Okay. Oh yes, and lastly, actually, so some family doctors' offices or even emergency rooms or COVID assessment centers, they're either having you wait outside until it's your turn and the room is ready, so you can go in right away. So you can wait in your car. So there's lots of options. So if you need access to healthcare, do not be afraid. Okay, or do not worry that you're going to catch COVID. Some other common things that you can do, I think Marcos already touched base on a little bit of them. So once you get your COVID test and you're home, things to do like to make sure you're hydrated, drink lots of fluids, rest. You can have some Tylenol if there's fever or body pains. And then if you don't get better, so you did your swab, it's negative, you're still not feeling well, reach out to your doctor again. If your symptoms are more than a week or they're getting worse, or the swab is negative, no improvement, just prolonged symptoms, anything like that out of the ordinary, reach out to your family doctor. And my last point is just to reiterate again what Marco said, is that antibiotics are not used to treat viral infections, and most cough, colds, COVID, these are all viral infections. So we do not prescribe antibiotics. And if you do need an antibiotic, that would be based on a very thorough history, again, ruling out COVID and doing a full exam. And in some situations, if there is, like a bacterial bronchitis or sinusitis or an ear infection or something that needs an antibiotic, your physician will know. But in general, most of these infections are viral. And that's everything. Thank you.
Thank you so much, Gina. And thank you so much to all of our presenters. The information that you guys gave tonight was so helpful, and I think we all really needed that health checkup. So now we're gonna start the Q&A period. We're gonna do it a little differently today, and our lovely moderator, Christina, has been working on compiling all the questions that were submitted on Slido, and then she also just put it again in the chat. So if you guys have any questions, submit your questions through the Slido link, and Christina will be presenting the questions to our speakers now, but just please remember our speakers will not be answering any questions regarding the COVID-19 vaccine. So thank you so much. Christina, over to you.
Sorry, Christina, just one quick thing that Gina reminded me of while she was talking. There is a website, it's covid-19.ontario.ca. If you just search COVID on Ontario, it'll probably be one of the first 2 or 3 links that comes up. On the website, there's a self-assessment tool, and there's a tool to help you find a testing location, just in case you guys wanted to do that at home. Right, it just asks you kind of what symptoms you have, and it'll tell you, hey, you should probably get a swab, or you don't have to get a swab, whatever it is. And it also has a tool to help you find the nearest assessment center near you. That's it.
All right, I really didn't do anything besides just set up the link. So in terms of compiling and summarizing, I didn't do that, so we're going to just do that on the fly right now, and just being mindful of time. We'll try to keep to less than 15 minutes so that we're out of here by my bedtime at 10 o'clock. So I'll just couple a few of the questions that I see here. Let's start off. Is Daniel still on the hook? Yeah, everyone's still here? Excellent. So Daniel, or to anyone that wants to help answer this question if you feel like it's within your scope. Do you have any strategies or tips to remember to move regularly? Is there a certain amount of time that I should aim to be active in the day?
It's a great question. So there are guidelines, generally, I think, like recommended by WHO. I can't remember it off the top of my head, but I'm pretty sure it's about 90 minutes per week. It's 90 or 120 minutes total of leisurely activity. But just in short, I think the point I was just trying to come across with is every half hour, get up and move for 2 minutes. Just whatever you want. I don't care if you want to dance Zumba, if you want to go and grab a bunch of boxes and sort out your cold room, try that. Fold some laundry, whatever it is, just every half hour, get up and move for 2 minutes. 5 minutes is even better. That's a bonus. It's just go out of your way to try and be mobile, and you will feel so good.
Excellent. Steve, I'm going to summarize a couple of these questions because they're pretty similar, but here I go. Is there evidence for the risk of premature vision loss with prolonged screen time? Also related to that, is it normal that your vision keeps declining every year? Kind of related. I tried.
I think I get what you're asking. I guess I get the premise of the questions. Can you hear me okay? Yeah, okay. So it's normal for when they say vision, I presume they mean prescriptions. So it's normal for it to go more nearsighted, so more minus or more myopia, which means more tuned to up close and more blurry at distance. That is normal for it to progress, and especially in the teen years, because that's when we do a lot more studying, high school and university. So the young age groups, it's definitely normal for it to progress. It's not, so there's something called pathological myopia, and that's where it just keeps progressing throughout someone's whole life. And that puts them at risk for lots of terrible things. So that's something that's not normal, and we label it pathological myopia. But so that's totally normal for it to keep progressing. What's not normal in the young age groups, and especially school age kids, is if it keeps progressing at a huge rate year to year. And so that's something we look for, especially when you're seeing kids a lot like me. So you look for a normal amount of progression. So we have classified like what's a typical amount, and if we see what seems to be a huge progression, especially year over year, or especially in a few months. The other month, I saw a 3-year-old with like a -8 prescription and severe something called astigmatism. This kid needs glasses just to like see the sun. Like he can't function, but his dad doesn't believe me. So what am I gonna do? So there's all this stuff that's kind of like, there's such a stigma maybe for some people about needing glasses or needing stronger glasses, especially when it comes to little kids. So they're more vulnerable, right? So if they need them, then they need them. And so it's normal for it to get worse. That's fine. Change the glasses. You need them. You need them. You need to learn, right? So you need to learn. You need to see so you can learn. So it's normal for it to get worse. We look at the rate of change to classify it as normal or abnormal. And yes, school age, so more computers, more reading, that does increase it, but that's expected. We look for the rate to classify it as normal or abnormal. Okay.
Awesome, thank you. I feel like this question is from John Mehta, and so I'm inclined to just skip over it. But since it is a question to Christine, and maybe she can maybe make it a little bit more generic, so it's not just John-esque an answer. It's what are your thoughts on intermittent fasting? What are the pros and cons? So maybe I can rephrase it as, what are your thoughts on altering your diet? That's not too generic.
I seem to get this question every year. So yeah, with diets, there is always that conception of, you have to limit something. And whenever you're removing food groups or restricting the way that you're eating, that's where I always have a problem, because, you know, is that sustainable? Is that something that you're going to continue into the future and that you'll be able to maintain if there's a change in your routine or your work or your life, whatever it is? A lot of these studies or diets have shown, you know, modest improvements. The research is still inconclusive. So in terms of, you know, intermittent fasting, there has been some modest weight loss, but again, is that sustainable? Is it going to continue out into the long term, or is it just something that's short term? There's also some preliminary studies saying that, you know, it may help with insulin sensitivity and your blood sugar markers, and, you know, lipids, and, you know, it goes further in depth than that. But again, the research is so inconclusive. It's still all in the early stages. So my general take every single time when someone asks me about a specific diet, you know, if you're going to have to restrict something or modify your diet and eliminate something, is it sustainable? And that's still the question that I always ask in the end. So it depends.
All right, we'll continue down the panel, I suppose, to Andrew/Marcos. So either you, Andrew, or your alter ego, Marcos, you can answer this question. Is the use of multivitamins helpful? I don't take any medication for health conditions. I'm just looking to ensure my body has all the vitamins it needs. So a question regarding supplements.
Not really. Multivitamins are useful in only certain cases. So right now in the hospital, for example, if the patient is not eating properly, then we'll give them multivitamins. If you are actually with us when we're fasting and we go vegan, you may want to consider adding certain vitamins, vitamin B, some iron, if you're not getting enough from your diet, because you can technically get it from your diet, but it's not easy. If you are on a strict diet, you may want to ask your dietitian what vitamins you want to add on top of that. But if you're getting a balanced diet and you're eating regular meals, you're not nutrient deficient in any way, shape, or form, you don't have any medical conditions, you don't need multivitamins. They're not gonna really do anything for you. But like I said, with a lot of these meds is just to stick with what's safe, right? In terms of taking the multivitamins, taking 1 or 2 multivitamins a day is going to be fine, unless you have specific medication that interacts with them, in which case you shouldn't be taking them at the same time. But that's another story, which you can discuss with your pharmacist on a personal level. If you're not taking any medications, you don't have any medical conditions, then they're probably not going to be helpful for you.
If I can just also add to that. So, you know, people ask me that all the time in my practice, and they're like, what vitamins should I be taking? As you said, yeah, we see it definitely in a clinical setting, or if someone has like poor intake or like some sort of a skin impairment that they need healing with or something like that. The only vitamin that I ever do recommend, just based off of where we live, is vitamin D for sure. All the other things, like if you're not getting blood work done and you're determining whether there's a deficiency or not, what are you taking it for? Please don't waste your money. So that's the only one that I would add.
Awesome.
Sorry, one thing. There are vitamins that you should be taking for certain things like vitamin D, because we're pretty deficient in our country. And as you age, you're supposed to take calcium, and but those are for all specific indications. But if you're young and not taking any meds, you're fine.
Okay, we're going to aim for one or 2 questions. I know there are a lot of other questions coming through. I think this site is active for a little bit. So if the speakers want to have a look at the questions, they can go onto the site. And if they're so inclined and want to send us an email with a few of your comments or suggestions or answers to these questions, we'll try to make it available by email. If someone is willing to email the answers out, that will not be me. So one more question, Gina, you started talking about this. I guess this person is just trying to lay down a rule. Is there a way to actually properly differentiate between generic flu cold symptoms and COVID symptoms? Or do you suggest or recommend that you get a good COVID test anyways?
Your question was food poisoning, is that what you said, versus COVID?
No, sorry, generic flu or cold symptoms.
Flu or cold, oh, okay. No, there's no way to tell, and that's where it becomes a very big challenge. And again, I want to reiterate, the COVID assessments centers are so easily accessible, fast. You book an appointment, it's on time, you're not there for more than half an hour, 40 minutes, and the swab is not that awful. Yeah. That's it.
Okay, yeah, and I can attest to the swabbing. I've had it like 25 times at least. It's okay. You can do it. I'll do one more question since we have 2 more minutes on the clock. This one's a fast one. Andrew, you were mentioning, I think this, can you repeat the type of Advil? I think he means aspirin, we ought to take in case of emergency or heart attack.
Yeah, I just saw that. It was aspirin 81 in case of a heart attack or stroke. Usually it would be, if I remember correctly, chew 2 tablets right away and then call 911. That's for, like, it probably won't be for the youth. It would be for family members who are seniors or anyone who has high cholesterol and high blood pressure or diabetes issues, like some underlying medical conditions that makes them more prone to get a heart attack or stroke.
All right, and one more question for Rafiq. Sorry. Is there, I don't know if you mentioned this in your presentation, but is there a recommended amount of time that or duration in which you have to dedicate to brushing your teeth twice a day? And I tried to look like I was reading that, but that's just my question.
Yeah. There is no, like, you know, time per se of you must clean your teeth. You know, like if you did 2 minutes and 50 seconds versus 3 minutes, then you did not do it properly. There's no, you know, there's no such thing. Some people are slow, so, you know, they take their time. Some people are maybe a bit more quicker. The most important thing is that you do it properly. You do proper technique, right? It's not, I know time is important, speed is important, but just proper technique, like, you know, apply the brush in the correct way, do the motion in the correct way, and you know, go through the arches. So go through the upper arch and then go down to the lower arch and go from the outside and on top and back and inside. As long as you do that, normally I say like it takes, you know, 3 to 5 minutes, something around that time. So if you're, you know, taking 20 seconds, you're probably not doing very, very good. Like, you know, and if you're taking 10 minutes, then you're doing too good of a job. So I would say it's hard to put a time, but instead of asking for time, ask for a proper way of doing it. You know, as long as you do it properly, then you know, time, just 3 to 5 minutes is roughly the amount of time it takes to brush your teeth.
All right, well, without further ado, it is 10:01, and if it's going to take me 5 minutes to brush my teeth, that's officially 5 minutes past my bedtime. Again, for the speakers, if you wanted to have a look at the questions that are on Slido or Slido, we pretty much covered most of them. There are a few ones that we left untouched, but that was just in the interest of time. If you feel like you can address those appropriately, you can send those answers my way, and we'll try to send it out to the crew group, perhaps in the next email. But I'll let Mary take over so that she can wrap up the night. And thank you, Mary, and thank you, Teresa. I think she's in the crowd. They both organized this incredibly last minute but amazing night. Thank you.
I'm actually going to pass it over to Teresa. So,
hi, everybody. Just bear with us a few more minutes here. Mary and I the whole crew team are wrapping up the series So just a couple of thank yous and some acknowledgements. Just bear with me. So thank you again to all these wonderful healthcare professionals for taking the time to share with us their valuable experience and expertise. We appreciate all you're doing, and we know that you're glorifying God through what you do. We'd like to just review a few key lessons we've learned from the series for anyone who's kind of been following or who missed some of the weeks. So number one, let's remember to ask about people. Just a simple, how are you? Are you okay? Could be a lifeline for someone. Number two, everyone will go through a season of loneliness at some point in our lives, and it's perfectly normal. Number three, one of the remedies to loneliness is to reach out and connect with others, and another is to serve others. Number four, be intentional with your time and with your social media. Number five, let's take the opportunity to seek solitude to commune with God and get to know ourselves so that we can emerge as transformed persons who will shine the light and love of Christ to all those around us. Number six, let us not ask what is our purpose, but rather who is our purpose, and that is Christ himself and seeking him. Number seven, there is always hope and we are anchored in Christ. And number eight, the body is the temple of the Holy Spirit, and we need to be mindful of staying physically healthy during this time and always. So as we wrap up this Coping with COVID series, we'd like to make a few acknowledgements on behalf of the SMSV crew team. Okay, so bear with me with this. So a huge shout out and enormous thank you to all healthcare providers and frontline workers for all the sacrifices that you've made and are continuously making throughout this pandemic. We know that you're still in the battlefield, putting your lives at stake and working extremely hard to keep us safe and healthy. We know you're tired, and some of you are burnt out and struggling with everything you're seeing and the things you're exposed to. Please know that we see you, we appreciate you, we love you, and we're praying for you and your families. You are truly our heroes. So let's not forget to keep cheering on our heroes and check in on them once in a while. We also want to recognize another group of professionals who are truly frontline as well. These are clergy, pastors, counselors, and therapists of all types. Some of you may risk your lives physically, and you all are taking on the burden of listening and supporting all of us who are struggling during this pandemic. You're also helping so many people through their experience of grief, which is so difficult during this time. Thank you also to everyone for all of the sacrifices that you've made to help others around you, whether it be staying at home, social distancing, wearing an uncomfortable mask, and following other recommended guidelines. We know how difficult it is, and we're truly so thankful to you. As all of us, as the one body of Christ, hence the t-shirt, are now exemplifying the verse from the Bible that says, "Greater love has no man than this, than to lay down one's life for his friends." John 15:13. We're all in one way or another laying down our lives for our friends, whether it be by putting our lives at risk as frontline workers or sacrificing our social lives, our physical comfort, and our usual routines and activities in order to protect the lives of those who are most vulnerable. For those of us who are most vulnerable, due to age, medical conditions, or feel stuck at home for any other reason, we know you feel isolated, and it's very difficult for you. We want you to know that you are not forgotten. Some of you may feel like you're not contributing to the war against COVID, but know that you have an essential and central role. As you've heard throughout this series, each one of us is being affected mentally, emotionally, physically, and certainly spiritually. You are our prayer warriors who are on the spiritual battlefield. Your prayers are what drive all the efforts that are being made. As you know from Scripture, as we know from Scripture, the effective, fervent prayer of a righteous man can accomplish much. James 5:16. Thank you so much for lifting us up in prayer and for your wonderful encouragement. Both of those things are so needed. Most of all, we thank God for his love and presence in this storm, and we know that he is in control and will work all things for good. He is truly our anchor, our hope, our purpose, our comforter, our counselor, our healer, our protector, and our guide. We are being held in his loving hands. and he will shine his light and is shining his light in this dark time. So thank you again, and glory be to God.
All right, good night.
Good night,
One last
good
thing. One last thing. We just wanted to say thank you again so much for everyone for joining us on this series. Please stay tuned for information about next week, as we'll be starting a new series, so you won't want to miss that. Thank you again, everybody. And Fedi, if you could end the night, if you don't mind ending the night in prayer for us.
Yeah, no problem at all. In the name of the Father, the Son, and the Holy Spirit, one God, amen. We thank you, Heavenly Father, for today and for this valuable lesson. Help it to be a reminder for us that we are stewards of our body and that we can take care of it as well as our spirit and our mental health as well. Guide us throughout the rest of the night and throughout the rest of the week, and bless everyone that is on the call here today. Through the intercession of Saint Mary, Saint Marie, Saint Marina, and all the saints, hear us with great things through our Father, who art in heaven, hallowed be thy name, your kingdom come, thy will be done on earth as it is in heaven. Give us this day our daily bread. Forgive us our trespasses, as we forgive those who trespass against us. Lead us not into temptation, but deliver us from the evil one. And Christ Jesus, our Lord, for thine is the kingdom, power, the glory, forever.
Thank you.
Thank you, team. Good night.
Have a good night, everybody.
Thank you, guys. Good night.
Thank you. Good night.
Good night, everybody.
Betty, good night.